Good afternoon. My name is Mark Kinlaw, and I'm president here at Rockingham Community College. And on behalf of our Board of Trustees, faculty, staff, and students, I welcome you to our campus and to Rockingham County, and thank you for coming out today for a very significant announcement. I want to especially welcome our friends from Blue Cross and Blue Shield of North Carolina, and particularly Dr. Patrick Conway, President and CEO. This is a very momentous day as Blue Cross and Blue Shield of North Carolina unites with the North Carolina Community College system by initially investing with 5 community colleges to support our healthcare programs. Dr. Conway, thank you for believing in us, and we invite with you, and we look forward to uniting with you in Blue Cross and Blue Shield to address the healthcare issues in our state. We face significant healthcare problems in our state, and Rockingham County is certainly not immune to any of that. And with the investment Blue Cross and Blue Shield of North Carolina will announce today, we will be able to address them certainly more proactively. Today you are in our simulated hospital. This facility, which opened in 2016, includes examination rooms, a trauma and emergency department, skills labs, patient care areas, ICU birthing center, and a surgery trauma department site. An atrium area is specifically designed for use by students in the community, and there are quiet spaces for study groups in addition to area where students can review and critique just completed patient scenarios. The campaign for advanced healthcare education raised $3.8 million of the total project renovation of $4.6 million. One of the biggest challenges that educators have is providing a hands-on training environment for our students. Traditionally, healthcare students are placed in a variety of hospital and doctor office settings in an effort to have them experience a wide variety of patient care. And we call these clinical experiences. Where previously our students worked in isolation and in a variety of buildings across campus, now students from all disciplines will come together like a real hospital to provide medical care. This facility houses our nursing programs, including our RN program, PN program, LPN to RN program, and the Certified Nurse Assistant program, our respiratory therapy, emergency services, surgical technology, and phlebotomy. We are proud of our health science programs, and we're looking forward to expanding them in the near future. You should have a copy of the program in front of you today, and it's my honor to introduce all of our guest speakers. Dr. Patrick Conway, President and CEO of Blue Cross and Blue Shield of North Carolina, will be our first speaker, followed by President Peter Hans, who is President of the North Carolina Community College System. Ms. Libby Madry, who is Chair of our Rockingham Community College's Board of Trustees. Mr. Mark Richardson, Commissioner in Rockingham County. Senator Phil Berker, Speaker Pro Tem of the North Carolina Senate, who is also a native of Rockingham County, and specifically Eden to be exact. And Mr. Jason Collins, who is our EMS Program Director here at Rockingham Community College. Each speaker will come up in order printed in your program, and then following Mr. Collins, the program will end, and then we'll have tours of the simulated hospital. Our students are here. They will be in action. Of course, they're all back here at the back, and we certainly welcome our students. It's what this is all about, is providing access and quality training for our students to address these types of issues that we deal with in our state. But you're also welcome to walk around the building and look and just see the training that's going on and look at our building. You're certainly free to do that. You don't necessarily have to be on a guided tour, but we'll provide that for you as well. So again, welcome. And I really appreciate Blue Cross and Blue Shield and what you're doing for our community college system and particularly for us. So Dr. Conway, I'll yield to you. Thank you very much.
Thanks for having me here today. I'm honored to be part of this special announcement. I once wore a white coat like many of you, really pleased to be here. Blue Cross's mission is to improve the health of the people and communities we serve across North Carolina. Today, I'm pleased to announce that Blue Cross North Carolina is investing $1 million in emergency medical services programs of 5 North Carolina community colleges to combat the opioid epidemic and to provide better primary care. The specific colleges, obviously here, Rockingham Community College, I'm pleased to be here, Brunswick, Lenoir, South Piedmont, and Wilkes, so investing across the community college system. By addressing primary care and the opioid epidemic, we can have a major positive impact on the health of the people we serve across North Carolina. I am still a practicing physician. I volunteer on weekends as a pediatric hospital medicine physician at UNC Children's Hospital. Take care of children often with multiple chronic conditions, often with social needs as well. I used to be a pediatric emergency room physician, and often parents would thank me for saving their child. And I'll tell you something about EMS. It was usually EMS and nurses that actually saved their child. So I want to thank you for all the work that you do on behalf of your current patients and future patients. To the students here today, you are going into a field that is a calling. Any work in healthcare is a calling. It's more than a job, and your patients and their families will need you. So I'll thank you in advance for that. So Blue Cross is honored to be part of today. I'm honored to represent Blue Cross, and with that, I'll introduce Peter Hans.
Thank you. It's wonderful to be back in Wentworth here at Rockingham Community College. I'm so pleased to be here. As president of the community college system, of course, I'm thrilled at the recognition of the role that community colleges play in healthcare delivery. As a longtime customer of Blue Cross Blue Shield, I'm so grateful for the company's generosity. As a North Carolinian, like you, alarmed about the plague that is the opioid epidemic ravaging our country, I am comforted by the fact there are leaders taking action, trying to help our families, our friends, our neighbors who are suffering. Rural North Carolina, underserved populations, they need this support. They need this support too. Dr. Conway understands this. He's a nationally recognized leader in healthcare in both the public sector and the private sector. Senator Berger understands this, as does Representatives Kyle Hall and Jerry Carter. We appreciate their support. Senator Berger is the strongest champion of community colleges in the General Assembly. And we are so thankful to him. His vision on workforce development and public education is moving us forward. Dr. Kinlaw, you and your very talented team here at RCC, a great reminder that North Carolina's workforce, and our healthcare workforce in particular, in large part depends on the strength of our community colleges. You're meeting this community's needs through innovation and a lot of hard work. Imagine what we can do with the resources to match it. So thank you, Blue Cross, Dr. Conway, Senator Berger, Representatives Carter, Hall, all of my friends here in Rockingham County. A great day to celebrate this community college. Thank you very much.
I am Libby Madry, and it's my pleasure to be chairman of the Board of Trustees here at Rockingham Community College now. We are all very proud of our college, as Dr. Hans has said. We appreciate that we are giving young people in Rockingham County the opportunity to move beyond a high school degree right here in our county. So we appreciate the many programs that are offered here. And as chairman of the trustees, we want to say to Blue Cross Blue Shield of North Carolina, thank you so much for recognizing us and so generously helping us with our science health program here in this beautiful building. Dr. Kinlaw has alluded to the cost, but the private money, we were so proud. The trustees voted in 2011 to start the renovation of this building, and $3.8 million was given by the citizens and another over $1 million given to the foundation so that this could become a simulated hospital. Several have spoken about the opioid crisis, which we are all keenly aware. I like to read George Will, the columnist. I hope some of you read him. I have to read it maybe twice to understand what he's saying. But he talked about the drug issue just this week in his column. I'd like to quote just one sentence that he said. Cocaine users around the world reported that their most recent cocaine order was delivered in less time on average than their most recent pizza order. Now that gets your attention. So, Blue Cross Blue Shield, we appreciate that you understand this situation far better than we do. And we thank you for your generous donation to us, and we will certainly use it in our health science programs. And at this point, I recognize Mark Richardson, who is a county commissioner here in Rockingham County.
One of the things that has been shown to me and proven over and over again since I became a commissioner is how essential collaboration and teamwork was to solve any problem. And the bigger the problem, the more of that collaboration we need. And you're seeing an example of it with our educational institutions, our health institutions, our governmental institutions, and private institutions. We need to get more citizens on board. In the early 90s, I was in the service, and my job was primarily involved with counter drugs. And in 1994, I said to myself, how can anything be more worse than this proliferation of cocaine and crack? Well, it's gotten worse. It's a slightly different problem, but the substances have changed somewhat, but the issues are just as valid. So I'm hoping that we can put this collaboration and synergy of multiple agencies working against it to resolve. All of your politicians, all your citizens should be involved in this effort. And to the good folks, the other 4 counties, whatever you do with them is going to help us. We know that that synergy exists. So we appreciate Blue Cross and Blue Shield for stepping to the plate and swinging a home run for us. I assure you, you can count on this college to use that money effectively. Another part of the political answer, and it's going to have to be at least in part a political answer, is at the state level. And there's been no greater champion in this counter-drug operation, especially the opioid epidemic, than our President Pro Tem. So, Senator Berger, thank you for being here, and we look forward to your words.
Thank you, Mark. I appreciate that introduction, and I want to thank Dr. Kinlaw and the Board of Trustees of Rockingham Community College for giving me the opportunity to be here on this occasion. And, you know, now more than ever, North Carolina relies on our community colleges to prepare our students for their careers and their college pathways, to train our workforce and to help grow our economy. And what a great job they do. I'm particularly proud of the job that is done here at Rockingham Community College, but I'm also proud that my friend Peter Hans is now the president of the community college system and doing a marvelous job there. So thank you for that. Blue Cross Blue Shield in North Carolina, I want to thank y'all for this donation, the generous investment that you're making not only in Rockingham Community College, but also into the other community colleges around the state. I know these funds will be going to continue your investment in North Carolina, and particularly in rural North Carolina. And of course, I'd like to commend Dr. Kinlaw and the administration here at Rockingham Community College for directing these funds to support nursing and emergency programs, programs that are critical for addressing the ongoing opioid epidemic here in North Carolina. You know, as that epidemic rages across our country and our state, we have not been spared from the effects of the epidemic, and it continues to have a particularly devastating effect in rural communities, including our rural community here in Rockingham County. Drug overdoses now constitute the #1 cause of accidental deaths in North Carolina. There is no single remedy to the opioid crisis, so every effective resource at our disposal must be deployed against this lethal epidemic. EMS workers and nurses obviously play a vital role in combating this crisis. They are often the first point of contact for victims of opioid overdoses or those seeking treatment for addiction to opioids. Yet too many of our rural communities face shortages of qualified individuals to serve those important roles. By putting this money here at Rockingham Community Colleges towards nursing and emergency services, our college is putting a down payment on the future of our county. And that future to ensure that our community has the tools we need to combat this vicious epidemic. And I want to speak particularly to the students back there. I want to thank you for the decision that you've made to not only attend college here, but also the decision you've made as far as the career you intend to pursue. It is something that is very much needed, not just here, but all across North Carolina. So I want to thank you for that. And again, I want to thank Blue Cross Blue Shield for what it's doing here, but also what it's doing across the state of North Carolina in this and many other ventures. So thank you very much. And with that, I believe I am to introduce Jason Collins, the EMS Program Director here at Rockingham Community College. Jason.
Thank you, Senator Berger. Good afternoon. As Senator Berger said, I'm Jason Collins, and I am the EMS Program Director here at RCC. I'd like to first thank Rockingham Community College, Blue Cross Blue Shield of North Carolina, and the North Carolina Community College System for allowing me to share my story today. So I'm going to tell you how I got started in EMS. I started my public safety career as a volunteer firefighter with Bethany Fire Department here in Rockingham County in 2000. Where I'm now an assistant chief. My EMS career began when I obtained my emergency medical technician basic certification from here at Rockingham Community College back in 2003. That class opened my eyes to several career possibilities. So I began employment with Rockingham County EMS in 2004 as a part-time employee and eventually became full-time in 2005. I went back to part-time in 2007, pursuing another career opportunity, but my heart was always in EMS. So in 2015, I came back to EMS full-time, actually with Guilford County EMS at that time, where I still remain part-time today. I was enjoying riding the ambulance so much that in 2007, I wanted to further my career, and I started paramedic school here at Rockingham Community College. Graduated in 2007 and then became a certified paramedic in 2008. But I still wanted more. I'm always trying to push myself. So in 2016, I came across the job opening here for the EMS Program Director. And after long discussions with my wife and a lot of thinking myself, I realized that that job is something that I wanted. So in 2016, I applied for it, and in September, I was lucky enough to be offered that position. I really enjoy giving back to the community that I was born and raised in. Here at RCC, we strive for excellence, and are always improving the education for our students. In the last 15 years that I've been involved with EMS, the career has been ever-changing and will always continue to grow. Paramedics are just not working on the ambulance anymore. They're working in hospitals, specialty clinics, doctors' offices, on helicopters, as community paramedics, and for insurance companies. The EMS program here at RCC has recognized the need for that education in the non-traditional setting and have included that in our education. We're always looking for new courses and are always keeping our current courses up to date with current practices. With a curriculum program and national accreditation in the EMS program's near future, we're always continuing to improve our outcomes of our students and quality of our courses, and ultimately improving the treatment and outcomes of our patients. Here at RCC, we have acknowledged that there is a vast opioid crisis in our community, and we have done what we can to increase the education for our first responders, students, and our community, along with our local EMS, fire department, and law enforcement agencies. I want to personally thank Blue Cross and Blue Shield for their generosity to our EMS programs, and I know with that money, we can definitely make a difference. I'd like to thank everyone again for letting me share my story. Again, we invite you to enjoy some refreshments in the back, and feel free to walk around our simulated hospital. If anybody would like a guided tour, please go to the lobby, and we will be happy to do that for you. Thanks again for everybody for coming out.